Hi Nancy, I understand that your friend who's a nurse informed me that many stroke patients have reported having received chiropractic care prior to their incident of a stroke. I appreciate you bringing this concern up. It's very valid. I would like to go ahead and talk to you a little bit more about that. There have been some studies made actually based on this comment, and one of the studies found that there's no excess risk to stroke after chiropractic care. And so the reason why some specialists do advise you not to seek chiropractor care is because they don't the patient often develops symptoms of stroke. So for example, they'll come in with neck pain, like some headache, and as chiropractors is something that we can help our patients with. So they seek our help prior to developing the stroke. Yeah. So what some of the results show from the studies was that there was no significant association between a stroke and a chiropractic visit. What I mean by significant difference is that just like any other treatment, it is not fully guaranteed that there's not going to be any risk involved. But the chances are low. If it's okay with you, I can go ahead and print you a copy of the study. That way you can go ahead and read and inform yourself, and maybe you can also go ahead and show it to your friend that's a nurse. And go ahead and if you have any questions, any comments, please let me know. We can definitely go ahead and talk about that a little bit more. But during your first visit, I'm going to go and be conducting a series of exams, which is going to go and include your vital signs. And it's just to go ahead and get a sense of your overall baseline, your overall health, so I have something to compare to. In addition, I'm going to be doing some neuro exams. This to make sure that the pain is not affecting any of the nerves that are coming out of your spine. I will be checking your ranges of motion, and so to see if the pain is limiting any of your movements. So for example, I'm going to have you raise your arm. I'm going to go ahead and check those numbers and see where you are. I'm also going to be palpating your muscles just to see if there's any tightness or tenderness musculature around that area of complaint. So this part can be a little bit tender, especially if there is something going on. I'm going to be palpating your joints just to assess any restrictions of motion, tenderness, asymmetry. So just making sure everything looks pretty symmetrical and there's not something that's kind of stuck. And lastly, I'm going to go and be doing some orthopedic exams. So the purpose of them is to go ahead and kind of recreate the pain, recreate your symptoms. So this might be a little bit painful, but this is also very helpful because it helps us understand what tissues or structures might be involved in causing your pain. And I know that was a lot. I'm going to go ahead and talk to you through the whole process, and any questions you might have along the way, just go ahead and ask me, interrupt me. I can go ahead and answer that for you. Just like any other medical procedure examination, there are risks involved, but benefits do outweigh the risk. You might feel soreness and tiredness after I palpate your muscles and adjust you. And that's okay. After a day or so, they should go ahead and come down. I do want to go ahead and talk to you about your stressors that are happening in your life right now. So I understand you work 60 hours a week, have high stress after the pandemic, and you've been getting about 4 to 5 hours of sleep each night. I would like to address each of these issues if that's okay with you. It is important to manage your stress because stress can produce a hormone called cortisol. Cortisol can lead to inflammation and issues with your body's ability to repair itself. And so the other thing that cortisol does, it keeps you up at night. Yeah, so you can see how like one thing kind of leads to another. Yeah, so by reducing your stress, it can lead to good quality sleep, reduce inflammation. It can also lead to a decrease in possibilities of having a stroke, and overall just reducing your stress, leading to lower cortisol making, and that's what we want. But working the 60 hours a week, high levels of stress, not getting much sleep can be it can be challenging to put your health first. So some alternative treatment options that are available to you are medication and surgery. This would be provided to you through your primary care physician or a surgeon, and I'm more than happy to refer you out to any of them. In addition, just making conscious health choices can be very helpful for you. So to prevent the stroke. So for example, throughout the day, choosing healthy meals and snacks. So talking to a nutritionist would be another option as well. But does any of that sound good to you? Do you have any questions for me?